I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to discuss why you have numbness and tingling in your legs and feet. So this is a really common thing for people to have. It can go down to the knee, it can go down to the foot, it can go into the thigh. When we talk about numbness and tingling, it just means that there is some point in your leg that you have numbness and tingling. It could be into your butt cheek. Depending on how far down it goes, depends on a bunch of different factors, which we're not going to get into in this video. That takes a lot longer explanation, but I want to go over some of the reasons that you do get that numbness and tingling in your feet, all the way down your leg into your feet. So one of the first ones is one of the first things I want to say is this is a pretty serious issue. So it's not something you want to kind of blow off and be like, it's going to go away. Numbness and tingling, whether it be in your hands, your feet, whatever, you do want to get checked out almost immediately. It's not something to wait for. It's not something to rub a little Bengay on and hope it goes away. If you notice that you are getting that numbness and tingling in your feet, in your hands, definitely schedule an appointment with your physical therapist, your doctor, because one of those things that it could be is it could be more of a systemic issue. It could be nothing to do with the musculoskeletal system. It could be more of a diabetes, something along those lines. So you do want to check out that loss of sensation in the feet or in the hands. See if it's something if it's something going on in your musculoskeletal system, or it's something more a little more systemic. But a lot of times what we see in here is we get numbness and tingling a lot. And the first thing people always tell me is I have a herniated disc. Well, you and 70% of the population have a herniated disc. So that's not uncommon. I have 5 in my back. I don't have any numbness and tingling. I don't have any pain. Unless I'm on my feet all day. I wind up getting a little soreness in my back, but otherwise I have no numbness and tingling, no back pain, but I know from a previous MRI that I have 5 herniated or bulging discs in my back. So that's not uncommon for people to have, is this bulging disc. And then they're like, oh, I get numbness and tingling because I have a bulging disc. A lot of times that numbness and tingling that goes down your leg is not always due to a herniated disc. There's something else going on. It could be muscle issues. So one of the things you do want to get checked out right away is, even though there is a bulging disc on the MRI, is that what is causing your numbness and tingling into your feet and your legs? A lot of times it's not. It could be a contributing factor, but many times it's actually other things that are causing that numbness and tingling. The best thing that shows up on an MRI is a herniated disc. So a lot of times, we just kind of throw that, or not we, but whoever reads your MRI will just kind of throw that off into that category and say, hey, you got numbness and tingling, you got a herniated disc, nothing more we can do, or maybe it's surgical or something like that. So, and when I talk about a herniated disc, I'm using the word herniated and bulging interchangeably. There are some differences in the terminology, but for our intents and purposes, herniated and bulging mean the exact same thing. So there is that issue that you could have a herniated disc, and maybe there is, and that's causing some of that numbness and tingling. But a lot of times it doesn't really have that much to do with it, or it's just a secondary cause of the numbness and tingling. A lot of times what happens is you have a lot of muscles throughout your leg and coming down into your spine, and those nerves go in and out, and they go in and out of the muscles. So what happens is your muscles get tight. Maybe you've had a back spasm. Maybe you don't have anything, but your muscles are just tight. I get a lot of times, I can't even touch my toes. I'm tight. I'm really stiff. When you're tight and you're stiff, what happens is your muscles shorten up, okay? So they go and they start to just shorten. So if they're supposed to be this long, they're now this long, all right? And as that muscle gets a little bit shorter, what happens is if there's any nerves running behind it, they'll start to smash those nerves. Well, as those nerves start to get compressed and smashed, they start to get irritated. They wind up being played like a string on a violin. And if you've ever seen nerves, or you had cadaver anatomy, they look like just little pieces of dental floss running through your body. All right, so it's not something that's really, really thick. A lot of times there are some thicker nerves out there, but it's a little piece of dental floss that's running in and out of these big muscles. As the muscles get tight, they start to compress. So as this compression happens, you start to get numbness and tingling. As the compression will get worse, you start to get numbness and tingling further down your leg. So maybe the numbness and tingling only went into your groin or went into your calf or excuse me, or went into your hamstring or your thigh. But now all of a sudden you're noticing that the numbness is going all the way past your knee. It's going all the way into your foot. Or, now your whole leg is dead all the time. So that happens when it comes to those muscles being in a compensatory position, okay? So compensation, huge for why you get numbness and tingling. What we talk about a lot in here is because of the compensation patterns that we develop. We sit all day at work, all right? How many of you sat for more than 2 hours straight today? No one in this office, but a lot of people have jobs that they sit for a long period of time. What happens is as you sit, you start to develop compensation patterns. I know it sounds weird that you would actually develop a problem while you're sitting, but you wind up dehydrating your muscles. You wind up sitting in slouch positions. Well, these slouch positions cause your back to tighten. They cause muscles to shorten. And with this shortening comes this irritation of the nerves. So a lot of times, we'll get piriformis syndrome. Piriformis syndrome is just a muscle in the butt. It's really tight, starts to have the numbness and tingling that goes down your leg. Sciatica. So FYI on sciatica, sciatica is a garbage can term. What does that mean? Sciatica means you have pain going down your leg. Why? I don't know. I don't know why there's pain going down your leg. Okay? So the broadest definition of pain going down your leg is sciatica. So a lot of times people come in and say, I have sciatica. Well, wait, great. What does that mean? Does that mean you have a herniated disc? Does that mean you have some compensation patterns going on? What's going on? So sciatica just means pain going down your leg. Numbness or tingling going down your leg. So I get a lot of sciatica diagnosis in here, and if you Google it, the stuff you'll find. It's amazing. So, and not in a good way, amazing. So just be careful when you say, okay, I have sciatica. I've been diagnosed with sciatica. That really actually means a whole lot of nothing other than you have pain going down your leg. You need to find out where that pain is coming from. So it could be coming from your piriformis. It could be coming from other muscles. It could be coming from muscles that get stuck in here, all right? A lot of times from sitting all day, you get tight muscles in through your abdomen. That will actually cause a lot of numbness and tingling, all right? You wind up running, and you wind up, with numbness and tingling in your feet. Could be because of the way that you're running. Could be because of how you're running. So there's a lot of different reasons why you get that numbness and tingling. Sometimes you have what we call stenosis, where your spinal canal is actually starting to narrow. This will show up on an MRI. So it's not something that, that's going to take a lot of guesswork. Stenosis will show up on an MRI. Bulging discs will show up on an MRI. Whether those bulging discs are causing the numbness and tingling, that has yet to be determined. Muscle compensation will not show up on any MRI. It will not show up on anything, any x-ray. It will not show up anywhere that we can definitively say, yeah, here's the picture, here's your muscle, it's short, that's why you're having that pain. You definitively find out if it's muscle compensation when somebody gets their hands on you. When you come in here, we take a look at you, we put our hands on you, and we find out where all the compensation spots are. And if those compensation spots make sense for the nerves to be entrapped. If you get numbness and tingling and you find that a change in position relieves that numbness and tingling, that's a muscle, okay? Most of the time that will be a muscle. Because of the fact that when you change position, you wind up lengthening the muscle. You wind up infusing blood into the muscle. So it's going to wind up loosening up what's behind there, loosening up that nerve, allowing for the numbness and the tingling to stop. When you have numbness and tingling, that is a very big warning sign. As I said in the beginning, you need to get that looked at. That cannot be ignored because it can lead to muscle loss. It can lead to decreased muscle function. So you need to make sure that you are absolutely, the minute you feel some numbness or tingling going down into your leg, into your groin, I don't care how far it goes down, into your butt, you need to make sure that you are getting it looked at.